Professor Roger M.K. Ying graduated as a medical practitioner in Hong Kong and received his training as a specialist psychiatrist in Hong Kong. He received further training as a cognitive behavioral therapist in the UK and in the US and obtained his master and doctorate degrees in cognitive behavioral therapy in University of Oxford in the UK. He is an honorary clinical professor of psychiatry in the Chinese University of Hong Kong and an adjunct clinical professor of psychiatry of Central South University of Changsha, Hunan Province of China. He is also the current president of Hong Kong College of Psychiatrists and is also the current Secretary of Education of World Psychiatric Association. He is involved as therapist, trainer, and supervisor in multiple national trials of CBT in China and is on the editorial boards of multiple international peer-reviewed journals.
It's my pleasure to be able to present my action plan today in this webinar. Next, please. Now, in the past decades or so, we know that actually there is a very high global burden of mental disorders. And as you can see in this presentation slide, major disorder, anxiety disorder, drug use disorders, alcohol use disorders, they actually contribute to very high percentage of total global burden of diseases throughout the world. So these common mental disorders should be considered as target disorders to be managed by mental health and possibly health professionals around the world. Now, but we need to ask ourselves the question, if we want to care for these disorders or care for the people with these disorders, do we have enough mental health professionals to take care of these patients? Now, in the past 1 year, WPA has conducted a global survey of the training profile of psychiatrists around the world. And we just had our interim results. As you can see in this slide, actually, for those countries that do not have any colors, especially on the right side, you can see that these are the countries who have responded. The previous one, sorry, yes. We have so far 25 countries who have responded to this survey. And these countries have been shown as those with colors in the map. You can see that actually those countries in blue are countries with higher number of psychiatrists. And here we can see that actually a lot of countries in South America, in Africa, and in Southeast Asia, they are not having enough psychiatrists. And we also noticed that in countries in the Southeast Asia and also in Africa, actually quite a lot of psychiatrists are young psychiatrists. They are probably not the experienced ones, and they would need a lot of support in terms of education and training. Now, when we talk about training in psychiatry, we need to understand that training is just a term. So we are also interested in about the quality of training being provided by psychiatrists. So in 2017, WPA actually conducted a global survey of training provisions around the world. And in fact, we found that 30% of member societies actually had training for less than 12 months for their psychiatrist. And the median number of months of training for psychiatrists among the surveyed member societies was 36 months. And another important point of note is that over 70% of member societies actually provide limited or even no subspecialty training, especially in the areas of child and adolescent mental health, psychotherapy, learning disability, and forensic psychiatry. So from the last survey, we can see that actually the training provision for training psychiatrists in a lot of member societies can be regarded as suboptimal. And the second fact is that we do not have enough psychiatrists in many parts of the world, especially in the underserved population areas. So what we need to do is to consider expanding the scope of mental health training to other doctors or even other professionals who do not specialize in psychiatry, given that the global burden of disease contributed by common mental disorders is so high. So another survey that we did in 2019 is to understand that whether our doctors, our general doctors, either be he or she as a general practitioner or as the family doctor or as a physician, whether they have had exposure to mental health training while they were doing their medical school. So WPA did a joint survey with the International Federation of Medical Students Association. The abbreviation is IFMSA. And we did a global survey on medical students. This paper is published in Work Psychiatry. And we found that actually psychiatrist was reported as a mandatory course in medical schools in 81 out of 83 countries being surveyed. And the duration of theory classes varied among different countries. And the duration of theory classes was actually worse in Asia and Pacific region. As you can see that among these 83 countries, actually 17 countries have only provided theoretical classes of less than 15 days. Now, you need to be aware that we are just talking about theories. We are not talking about practical training. So even in terms of didactic lectures, in terms of provision of theories on psychiatry to medical students, quite a lot of countries are providing a very limited education. And when we look at the duration of practical classes, we can see that a lot of countries, here you can see 29 countries out of 83 countries have less than 15 days of practical classes. That means a lot of medical students have not been exposed to mental health education in the form of psychiatric interviews or having clinical attachments to psychiatric units. So as we know, in the absence of experiential learning, the learning will be far, far suboptimal. So from this survey, we also know that our doctors are actually not very well prepared to take care of patients with common mental disorders, even at the very early stage as a medical student. So they have very limited background knowledge about mental health care when they graduate from the medical schools. So we know that the medical school is not providing adequate education to our medical students in preparation for them becoming practical doctors or family doctors. So there is a lot of discussion whether the family doctors can be trained to provide primary mental health care in a lot of countries. In a lot of countries, the primary care doctors are the first filter in the pathway of care for patients with mental health problems. So we are interested to understand how family doctors are actually equipped to provide mental health care in their own surgeries. So in the 2 years ago, WONCA, this is the abbreviation for the World Organization of Family Doctors. This is a global organization representing family doctors around the world. And they have a working party on mental health. And they come up with a set of core competencies of family doctors in primary mental health care. And in these core competencies, the family doctors delivering primary mental health care have to be able to demonstrate the competencies as follows. Number 1, values. Number 2, communication skills. Number 3, assessment. Number 4, management. Number 5, collaboration and referral of appropriate cases. Number 6, reflective practices. So what we tried to do is to understand whether these core competencies can be considered as equally important in the eyes of psychiatrists, because we think that these core competencies have been initiated by the goodwill of the Working Party of Mental Health Care in WONCA. And we're interested to see whether psychiatrists would think these core competencies as necessary and important for primary care doctors providing mental health care. So last year, WPA had a joint survey with WONCA, and we wanted to understand whether the respondents would agree that the core competencies listed out by WONCA are relevant and important for family doctors in primary health care. So we surveyed a number of senior psychiatrists, most of them being the presidents of member societies. And we actually found that all these core competencies were regarded as relevant and important for family doctors. There was just one competency being seen as less relevant and important, i.e., the application of cognitive behavioral therapy and psychosocial interventions. And there are a few competencies that are viewed as not demonstrable in family doctors in their own localities, including the competencies in cultural assessment, risk assessment, engaging and supporting family carers, and reflective practice. And then, just as we've mentioned, these are the core competencies that both primary care doctors and psychiatrists are regarded as important core competencies. So in this kind of situation, these core competencies would be focused on future training of family doctors in enhancing their ability and competence to provide mental health care. Now, just now, we've also discussed that doctors are not enough in most countries. And we've also mentioned that psychiatrists are not enough in most countries. But we can see that from this slide, actually, we are not just having a shortage of medical manpower in the underserved populations. And in fact, we can see that in the underserved populations, they have an equal shortage of other health professionals, including nurses and other allied health professionals. So what this implies is that when we talk about education of mental health, we should try to have a more wider perspective, or more lateral thinking on how we can enhance education of all stakeholders so as to ensure that mental health care can be more accessible and acceptable to the people in need of mental health care in all countries around the world. Now, so what are these stakeholders? Now, these stakeholders include our peers, our service users, our carers. Now, we need to think about laymen. Now, these are the people in the general public. They are actually important stakeholders, faith healers. And we know that very often for a lot of people with mental health problems, seeing a religious leader is always considered as the first point of contact along the pathway of care. Traditional healers and licensed healers, they aren't very important as well, because these are people who are considered as culturally acceptable and culturally accessible by a lot of people. Care home staff, they are actually people taking care of people who are having different physical or mental health care needs. And they actually have a concentrated group of vulnerable populations within their house. So like the institutional staff, we know that social welfare needs are a reflection of the mental health needs. And of course, in a lot of countries, as we know from another survey with the IFMSA, actually in a lot of countries, medical and nursing students are people who have the responsibility of making diagnosis or even providing treatments for people with mental health care. So these are potential stakeholders in mental health care. And just now I've mentioned about other health professionals apart from mental health professionals. So given the diversity of stakeholders of mental health care, so what should WPA do in terms of mental health education? Now, what I've proposed in my triennial action plan is that we need to have multi-pronged strategies to enhance mental health education. My priority should focus on delivering education to low and middle income countries where the need is most pressing and where the mental health capacity is the least. And the second important point is that we have to work with medical and nursing students. There are many reasons for that. Number one is that they need to be equipped to be competent in diagnosing and treating common mental disorders, so that when they graduate as doctors and nurses, they would have the essential skills and knowledge to handle most of the patients in the community. And the second purpose is that when we shape these professionals with a new attitudes towards mental illness, that would lead to destigmatization and better acceptance of mental illnesses among the health professionals. And of course, the third purpose is to enhance recruitment into psychiatry, because among the eyes of a lot of medical and nursing professionals, psychiatry is still considered as less desirable medical subspecialty to devote life into. And the third point is about training of family doctors and health professionals with the basic skills in diagnosing and managing common mental disorders. And just now, I've mentioned about the importance of service users and carers in the care of patients with mental health problems. And I think it's important for us to provide training to them as well. Now, on this point, I think it's very important to remember that we actually learn from our service users, and we also learn from our carers because they are experts in their mental health problems. They are experts in the care of people with mental health problems. And very often in my interaction with service users and carers, actually, they have provided me with a lot of stimulating insights about the care of patients with mental health problems, as well as the design and delivery of mental health services to people with mental health problems. So I think this is an important part that WPA will need to focus on as well. Now, the last but not least is that since I've mentioned that lay and faith healers are very important gatekeepers for people with mental health problems, so I think it's important to educate them to recognize mental health problems and to provide appropriate referral to mental health professionals. And again, here, I think the mutual learning is important, especially in terms of how the lay and faith healers would reframe mental health problems into some kind of formulations that are acceptable and accessible to people suffering from mental health disorders. Now, in the coming 3 years, actually, in order to fulfill the target participants or the target students that I've just highlighted, it's extremely important to consider how we can reach these people, especially that they live in low and middle income countries. In the traditional mode of learning and teaching in WPA, we conducted a lot of workshops, a lot of regional and world conferences, and we know that those participants usually come from professionals who have the means to attend these courses. And it involves a lot, of course, in terms of travel, in terms of accommodation. Although WPA has tried to hold some of these regional conferences in places with underserved populations, we found that it's still equally difficult for the professionals from the neighboring countries around the host country to attend, simply because of political, because of economic, and also financial issues. It's also because a lot of these professionals are very busy with their work, given that they are really valuable resources in their own localities. So because of time and financial constraints, we find that this is not a good way to reach everyone. Now, I think from the past 2 years, COVID-19 pandemic has actually made a lot of impact on mental health care. It creates more mental health problems. It also affects our connection with other people. It also disrupts our life routines. And it also affects our education. But thanks to the availability of the internet and the smartphone technology, we've been able to connect with other people using various gadgets and softwares like the Zoom, like the FaceTime, or like other meeting platforms. So we would be able to use such technology to connect with people around the world. So what WPA has done because of the catalyst of COVID-19 pandemic, we've set up a new education platform. This is an education portal using the learning management system. So if you go to WPA website, if you go to the sections and education corner, you can see that you can access the education portal here. It's important for you to register as a user, and you will be given a username and a password so you can enter into the education portal. So what we have in the education portal consists of educational modules and educational courses. Now, for educational modules, these are educational materials in the form of slides and presentations, as well as quizzes. So our participants can enter and join the educational modules at their own convenient times and in a convenient place, and then they can finish the educational module and apply for a certificate of completion. And they would be awarded with some WPA CPD points as well. Now, we also have the educational courses. For the educational courses, we conduct them in the form of live courses to begin with. So we would send notice to all member societies and also have this being available in our website, in our Twitter, in our Facebook pages, so that our member society members can be aware of the time of the live webinars or the live courses, so that they can have immediate access to experts talking in a particular field of mental health education. And then after the live courses, we've tried to record some of these live courses and have them available and uploaded into the education portal so that other participants can also go back to read or join these recorded webinars or courses. And now a lot of these modules and courses are actually free. So we want to make sure that professionals from low and middle income countries would be able to join and to benefit from these free courses and webinars. Now, for these courses and webinars, we have different topics. For example, we have topics on depression, and we have topics on intimate partner violence and its management. We've also got courses on early intervention and psychotherapy modules as well. And for the live courses, we have just finished a course on telepsychiatry, and we've also got live courses on other areas, including supportive psychotherapy. And in the coming months, we are going to have more courses. For example, we are going to have a course on suicide and its management, a course on psychosocial rehabilitation, a course on psychiatric genetics as well. And in the coming months, we also hope that we can upload some of the Congress workshops and some key lectures into the education module, so that our members from different parts of the world, especially those from the low and middle income countries, as well as primary care doctors and medical students, they would have access to these educational materials. And these second plan of action that I'm currently focusing a lot, it's about WPA volunteering. Now, although online education is extremely important to benefit professionals and also other stakeholders, we know that very often these courses could be rather didactic, and they involve a whole group of people consisting of over 100, 200, or even 1,000 participants. So it would be very difficult to tailor make any topics that would benefit a particular country or a place in terms of addressing their mental health training needs. So on this aspect, we've come up with a working group on volunteering. It's co-led by me and also Dr. Sylvia Thompson. And Dr. Sylvia Thompson was the previous chair of the section of volunteering in the Royal College of Psychiatrists. And she has a lot of experience in doing volunteering work in different parts of the world. And we are very glad that we have other members in the volunteering group who are also experts that have active participation in providing volunteering. Now, so in the work group, actually, we've come up with a set of guidelines on how we can facilitate volunteering from one country or from one member society to another host country or member society. So in essence, WPA works as a platform to facilitate the volunteering work from one member society to another. And in terms of the responsibilities and roles of the volunteers and host countries, we have also listed down the important attributes required from both sides. And we think that it's important to involve the member societies to nominate the volunteers, as well as to identify the training sites of need in the host countries. Because we hope to maximize the impact of the volunteering activity in changing the care landscape of the host country. So we hope that the host member society can identify a care training need of that particular country, so that WPA can then invite potential expert volunteering member society to nominate relevant and appropriate expert volunteers to be involved in the volunteering activity. So this is a very big project. It involves multinational activities. And currently we have just completed one pilot project in Mexico, and we are now doing another pilot project in Pakistan. And the outcome of the first pilot project is very good. And the volunteer to teach to the Mexican colleagues, it's very positive about the experience. And also the participants from Mexico are very satisfied with the process as well as outcomes of learning throughout the volunteering. Now, you might ask how we could provide volunteering in this era of COVID-19 pandemic. Now, this is again a catalyst of changing our mindset of providing volunteering. When I started the idea of having WPA volunteering, I focused on providing in-reach or physical volunteering in the host countries. But ever since the COVID-19 pandemic, we started to explore using online method of providing volunteering. For the current two branch projects, we are mainly providing online volunteering. But in the coming future, once we have completed the pilot project and their evaluation, we would open up to all member societies. And then we will think about having hybrid volunteering in the coming future. And we believe that a hybrid model would benefit the participants in the host countries the most. So if you are interested more about my action plan, please kindly read the paper that I've prepared in the World Psychiatry. So I think I've mainly described what I've discussed, and especially in the area of online education and volunteering. And the other plans that are in the pipeline include further collaboration of training with other world associations like WPA, and also work to mentor medical students and early career psychiatrists. We've been doing that in the online education and also the volunteering work by involving early career psychiatrists in the preparatory work. The research work, I think it's important for us to continue some of the important global surveys that I've mentioned. And just now, for the global survey on training profile of psychiatrists, this is just an interim result, and we plan to conduct the second phase of the global landscape. And I hope that all member societies will be able to join the survey so that we have a more representative picture of the global training landscape of psychiatrists around the world. And that would be very important for the strategic planning of manpower and also mental health training of professionals around the world by WPA. So thank you very much for your patience in listening to my presentation. And if you have any problems or any queries, you are very welcome to email me or to have a chat with me. And I would be very happy to learn from all of you, and all your feedback and ideas would be very treasured and valued by me. Thank you very much.
We thank Professor Roger Ying for his interview presentation today. Thank you.